Welcome to Medgalaxy, your go-to destination for all things medical knowledge. Today, we embark on a journey into the intriguing realm of crude drugs, delving deep into their chemical and therapeutic classifications and shedding light on the distinction between official and unofficial drugs. Let's kick things off with the chemical classification of crude drugs. These natural substances, derived from plants, animals, or minerals, play a crucial role in medicinal practices. Alkaloids, glycosides, tannins, volatile oils, resins, and steroids are among the key categories, each with unique properties and effects. From morphine to digoxin, these compounds offer a diverse array of benefits. Moving on to therapeutic classification, we explore how crude drugs are categorized based on their healing properties. Analgesics for pain relief, antipyretics for reducing fevers, anti-inflammatory agents for combating inflammation, antibiotics for fighting infections, cardiotonics for heart stimulation, and laxatives for aiding digestion are just a few examples of their therapeutic uses. But wait, there's more. Crude drugs are also classified as official or unofficial. Official drugs meet stringent standards of purity and quality, listed in pharmacopoeias for their efficacy. On the other hand, unofficial drugs, though not standardized, are often used in traditional or folk medicine practices. Understanding these classifications is essential for pharmacologists, herbalists, and medical professionals alike. By discerning the chemical and therapeutic properties of crude drugs, as well as recognizing the difference between official and unofficial status, we ensure safe and effective medical practices. So, as we conclude our exploration, remember the importance of this knowledge in your medical journey. Stay informed, stay healthy, and continue to seek out the wonders of the medical world. Thank you for joining us at Medgalaxy. Subscribe, and stay tuned for more enlightening content. Until next time, take care and stay curious.